Special dinner to celebrate the 15th anniversary of ICIM, the International Center for Integrative Medicine. And as you know from this morning's work, this is really the vision of Dr. Amy Matecki, co-founder Craig Brandt, and the board of directors. I would ask the residents to please come forward to present Dr. Matecki. Well, maybe. Kevin, Carrie, the flowers, please. Oh, no, it's to start. Oh, well, one little communication. While Kevin is doing that, let me announce to you that this is Dr. Matecki's vision of an intimate dinner for 50. And when we realized we were going to far exceed 50, Dr. Matecki, in her inimitable way, said, well, I still wanted to feel intimate. So she did a design, and those of you that know her know that the design was so amazing. The hotel was like, we can't do that. We can't, it won't fit in the room. We can't make it happen. So we did a little unconventional numbering, putting 1 and then coming forward to the end with the board member tables. But the vision is that everybody will mingle, which you've done a great job so far, particularly at the reception, and that you'll continue to integrate, particularly as we get through the program tonight. And there's an opportunity for you to hop tables and meet people, introduce yourself to speakers or other people that you might want to know. Okay, let me turn this over then to the residents of our integrative medicine program. Dr. Matecki, would you please come to the stage?
Should I give you first, or say something? Okay. Hello. So, just a few words to thank Dr. Matecki for all that she has done for us. I will be frankly honest, like a year ago, or a year and a half ago, was when I first began to apply to the Sutter residency program. And I honestly was so surprised when I first came in at how amazing this program is and how much I have learned from all of its teachers and faculty. But especially, I have learned so much from Dr. Amy Matecki. And she has truly inspired me to go further with my studies and not just limit myself to traditional Chinese medicine, but to also open my mind to further modalities, you might say. And I think a lot of people tonight have said that we're, I forgot the exact phrasing, but sitting on the shoulders of giants, which of course is very true. However, I think maybe a more appropriate saying that I like is that we, the students, are able to shoot for the stars because one giant moved the clouds for us. And that giant is Dr. Matecki. So thank you so much, Dr. Matecki.
Thank you, thank you. Here. Oh.
I will announce that. I'll announce that. Just give the gift.
I tell you, I'm so nervous now, more worse than I gave the talk this morning. And this is a totally out expectation. And also I want a really special thanks to Dr. Osler. And I have so many of you come to me, see how well organized, and this is a totally out of a surprise. Thank you, Dr. Osler, Dr. Feng, and everyone. Thank you. Thank you. Here, our wonderful students, just incredible. I learned so much from them. Someone went to Japan, speak many languages, and come to our program so humbly, want to be a student. This is all doctor students in Chinese medicine. So I learned so much from them. Thanks to 5 branches, university, your student, thank you.
You'll need extra arms.
Should I call Dr. Ma?
I'm sorry?
Should I call Dr. Ma?
This is just for
Dr. Mateki, what you've offered us is so amazing. And I'm so glad that you did come out of the nest and to provide us with this wonderful opportunity to stretch ourselves, to learn about Chinese medicine, Western medicine, and the integration of the two, to become confident and to continue the journey of how we can bring this medicine together to best support our patients and to provide such a wonderful model of how to do this and how to be a fearless leader. Thank you so much.
Can I get my signals crossed? These are
Would Dr. Ma please come up to the stage? Dr. Ma, we'd love to present you with these flowers. And thank you so much for all of your guidance, yes, thank you.
It's okay. Thank you. That is really a surprise. I think only Dr. Mataki can receive the flower. So, probably because we graduate from medical school, so that is, I have the honor to have the flower also. So thank you for all the, Dr. Finney, you trained us, from the high lab. Thank you, Dr. Joanna, and you sent a very excellent student to us. That is, we can just let the Chinese medicine be for the people's medicine. Yeah, thank you. I can go, right? Yes.
So I have a very special bouquet of flowers to somebody very special who runs this program, ICIM residency, which I'm a part of. My name's Jessica, hi. And she helps with our logistics. She helps pull the whole program together. And she does it with masterful planning and humor. And I've really appreciated her guidance in this program. So this is for you, Dr. Osler.
I want to shout out to all the faculty from the ICIM, our residency program, Dr. Ma, Dr. Kara Romenko, Dr. Julie Drew, Dr. Wayne Mateki, and Dr. Chris Randall, and everybody who has been our lecturers, who have been our faculty, who have given
speeches, encouragements, helping us with research, helping us clinically, and just everybody's support along the way. Actually, this one, the residents chipped in, and it's actually for Dr. Osler, because this event, and frankly, this organization, ICM, will not, this ship will not sail without the help and support and generous planning from you. So this is from the residents to you, and to all the faculty and to all the supporters of ICM and our residency program. Thank you.
So that was a total surprise. I didn't orchestrate that one. We want to acknowledge the primary care at home, table 12, who brought the flowers, except for the resident ones. Thank you for that. Okay, so now it is time for, if I get the right clicker in the right hand, dinner. Enjoy. We'll be coming back and talking with you a little about the history of ICIM and then doing our recognitions and awards. And Dr. Gregory LeBlanc. Thank you all for enjoying your dinner and continuing to talk and to exchange ideas. And I'm sure you're all thinking about next year, what are we going to do? Even more good stuff. Before we do that, I want to first give you a little bit of history of ICIM so that you understand why we're here and what we're celebrating, particularly for those of you that weren't able to be here with us this morning. This is the first annual Integrative Medicine Summit, and it all started back in 2009 when Dr. Matecki, Craig Brandt, Dr. Feeney, and a larger group went to China to see what Dr. Matecki was talking about this integrative medicine and the blending of East and West. And from that China trip, you may not be able to see on the slide, but what it shows is the lock that says ICIM. And someone else will have to tell you where the lock is and what it means, but I think it's significant. And after that, the board of directors was formed and the nonprofit was organized. Okay, thanks. I'm being broadcast elsewhere now. Great. No pressure. Okay, and shortly after ICIM was founded, Dr. Matecki worked with Dr. Alex Fang to initiate the medical Qigong program for people living with cancer at the Comprehensive Cancer Center, and then opened outpatient acupuncture, traditional Chinese medicine at Alta Bates Summit Medical Center. And I just have to tell you a little story about that. When Dr. Matecki called the clinic, Dr. Fang said to me, "Would you return this call? I think it's just someone else that wants to pick my brain. And my brain is tired. I just can't continue to do this." So I called and talked with, I think, Carmesita first, who sent me to Amy. And I said, I think you need to talk with them. So the two of us went over, and out of that was born this. And then with the leadership that you heard from Dr. Feeney and Dr. Lynn Berry at Highland Hospital, they began the negotiation to bring the TCM residency to that community hospital. One of the other big achievements that ICM has is something called VLEAD. And I know many of you saw the posters and someone said to me, "What is VLEAD?" And it's not something you can look up on the internet, but it's a very important group to us. This is a project that Dr. Amy Matecki and Gabrielle Lecomte started in 2020, where they have the purpose of preparing high school students to critically review the medical literature research and to develop a research project, and from that to do a systematic analysis, and then do a poster presentation, a public presentation, and prepare their article for publication. And these are an amazing group of people. I'd like the VLEAD people to stand, if you would please, to be recognized by the whole room. We have the Arjulas and the Gandes with us, and led by Krishna, and Dr. Lecomte, who is the mentor. Thank you. Everyone's always amazed when they hear them speak. And I think Arnav started with us as a junior. I'm old, so I can't remember. What's before high school? 8th grade, thank you. We called them different things, you know, but 8th grade. And he comes across as if he's a seasoned researcher already. It's very impressive. As you know, also around that time, the Highland Hospital residency closed, and Dr. Matecki picked up negotiations with Sutter Bay hospitals and spent the time during the pandemic doing that negotiation and revising the curriculum and working with Five Branches University to recruit additional students. So in 2023, a new integrative medicine, traditional Chinese medicine residency was opened at Sutter, and you've met many of the residents in that cohort. The other big achievement that we had this past year is a collaboration with PACI, the primary care at home folks. They have done an amazing piece of work, and I'm going to talk about them a little bit later, but they do mobile care. primarily for HIV community, the homeless community, and they try to bring integrative medicine by collaborating with us to do that. So this year we opened a community-based service in a mobile clinic in Campbell, and Dr. Ma is the one that did that for us. So real quickly, what's in the future? Our second annual Integrative Medicine Summit is planned for October the 12th. And Dr. Mateki says that you're all volunteering on the committee. That she told me. So it must be true. But some of you have already stepped up and said you want to help. So we'll be collecting names. That would be great. We also want to start a research committee along with that planning committee where people can review abstracts for next year so we can have an ongoing initiative to reach out for papers to be presented at the summit. The other things you see there, we want to essentially maintain and expand the programs that we have and also start looking at herbal research, particularly putting herbs in the hospital in the acute care setting, continuing to collaborate with PACI for potential new sites. And then that big one that we've been talking about all day is to secure sustainable funding. So that's ICIM. How did we get here? I'd like to recognize the people who enabled us to do that. If the board of directors would come to the front, right down here, please. And Dr. Drew? Dr. Amy Mateki, our inimitable co-founder and the president of the board. Craig Brandt, the co-founder of ICIM, our counsel, and I think your secretary too, vice president. Well, he likes to change titles around. Dr. Colin Feeney, who we've already described as our champion at Highland Hospital. He's also been on the board of directors for the duration of ICIM. And Dr. Alex Feng, also on the board of directors as well as his other slots. And Roger Smith, one of our hardest working board members, always coming up with good ideas on how to stay organized and out of legal trouble and financially solvent. So it takes a foundation like this of the board of directors that enables us to maintain the forward motion. I really appreciate all five of you. I can't quite even see Amy there. And I'd ask you to please stay up front and help me present the rest of the awards. We drafted Krishna Bachina to be our committee chairman for community education. And Amy, maybe you could just read that.
Appreciation of your vision, dedication, and extraordinary services to the community education initiatives and ICIM lead project of the International Center for Integrative Medicine, 2020 to 2024. Thank you, Krishna.
Thank you, Dr. Mateki.
to the two dynamos from, I don't have the mic. Our next award is to the two dynamos from Five Branches University, Dr. Joanna Zhou and Ron Zagman. They have been not only dedicated supporters, but their fierce determination to provide effective Chinese medicine has produced a number of really remarkable practitioners, and we're very lucky to have had many of them in our program. The next one goes to, what? I gave it to them. They have it. Amy. Dr. Mateki. Our next award goes to the primary care at home people. If An would come forward to receive the plaque, please, An. I know you don't like this, but you have to do it anyway. And primary care at home is such an important community-based program. It's really very special for us to have you in our group. And the next is for one of our sponsors, and I'm going to let Dr. Mateki introduce her.
It's for Athena Liu Goodman. Athena has many of the titles, but mostly important is she is the big supporter for our residency scholarship program. We want to give her this award. She's been with ICIM for over 5 years, been very quietly and behind the scenes support us. Thank you, Athena. The second one is Louis Lam, Mr. Lam. He is another one. Maybe many of you see him very active in San Francisco, support the Chinese hospital there, so I asked him to support Auckland. So here he is with his friends there. Thank you, Louis. Mr. Lam.
Thank you for your help, Dr. Mateki. And now another big supporter of ICIM, Sandy Saul. You can read it.
Can you read this one?
Sure. Yeah. This is International Center for Integrative Medicine, Sandy Saul, in appreciation of your support and guidance for the initiatives and organizational strength of International Center for Integrative Medicine. Dr. Amy Mateki.
Thank you, Sandy.
Okay. Yeah.
Bill?
This is it, in appreciation for your support and voluntary services to the initiatives and ICM TCM residency program of International Center for Integrative Medicine. Thank you.
Okay, thank you. The honor belongs to everyone. It belongs to the world. Thank you. And also my son.
Thank you. And now we want to recognize another integrative medicine practitioner in the community, Dr. Erling Chang, and Dr. Feng has your award. Could you pass this down to Alex, please? Could you pass that to Alex?
Alex.
Erling Jiang, OMD licensed acupuncturist, in recognition and appreciation of your innovative and compassionate work with the Fountain Project, paving the way for integrative medicine for all. Thank you, all of us, ICIM and Dr. Mateki.
Thank you. Okay, and then Li Shudong, Dr. Li, Whoever.
Li Shudong I've known for a long, long time. When he first came to the United States, he did tournament in Wushu. Always first place, first place, first place. So, Li Shudong, PhD, Tai Chi Science Federation, in appreciation of your ongoing support and partnership with the Education and Research Initiative of the International Center for Integrative Medicine. Thank you so much.
Thank you. I'll ask everybody except the Board of Directors to please be seated again. And Dr. Fang, we have two representatives here from the People's Republic of China Consulate. If you would please recognize them.
This is 中华人民共和国旧金山领事馆，就是 the Council of China, People's Republic of China representative, and I only see He Xiaolu. Please come up.
Thank you so much, Dr. Mateki and Dr. Osler, for inviting me to be here on this auspicious occasion to celebrate the ICIM's 15th anniversary together with all of you. So I have brought a congratulation message from the Consul General of the Chinese Consulate in San Francisco for all of you. And I'd like to read the congratulation message for you. The Consul General Zhang Jianming would like to extend his hearty congratulations on the 15th anniversary of ICIM. ICIM prides itself on its dedicated efforts in combining treasures of traditional Chinese medicine and Western integrative medicine to create benefits for patients, practitioners, and community. Its pioneering exploration in integrative medicine research, education, and clinical practices is truly commendable, and wish you greater success in the future. And because I'm a diplomat, so I'd like to put an advertisement for China. Welcome to China, and welcome to visit China to see the China traditional Chinese medicine as well as traditional Chinese culture with your own eyes. Thank you.
Thank you very much. Thank you so much. Now we'll have just a little tiny break with something different before I introduce our faculty. And I'll ask Bonnie Bowie to come forward, please. I guess you could sit down, then I need you to come back. Oh, how nice. Yeah, thank you. We wanted to get at least one story in here from the patient perspective about integrative medicine. And so I'm really happy to introduce you to Bonnie Bowie, who said to me, but yes, of course you do it. Thank you, Bonnie.
Oh, I have to hold this? No, I can put it here, right? Can you do that?
I can do it. I think I turned it off. I'm sorry.
Can I?
Speak close to it, it'll stop it. The closer you get, the better.
Can you hear me? No, this is too loud. Okay. Anyway, I said, well, that's okay because, I have chemo brain, so I'll just do everything and you'll just put it on my teleprompter. So Charlene said, what teleprompter? So anything I say. Anyway, I'm happy to say a few words about the integrative medicine and its impact on my life. I have stage 4 metastatic breast cancer that was diagnosed in 2017. The hope of the therapy at that time was that it would delay the progression of the disease for 9 months. Figure it out there. Ibrance had only been approved for about 2 years for treatment, but the statistics now indicate that it will delay progression of disease for 24.5 months. Anyway, for me, it's been 7 years. So how does my journey relate to integrative medicine? Well, it started really before the metastatic cancer. I was originally diagnosed with breast cancer in 2010. And about 2 months into my traditional therapy, I developed neuropathy of my hands. And my wonderful oncologist, Dr. Martha Tracy, said, well, we have this doctor, Dr. Amy Matecki, who's had some success with treating neuropathy. So she gave me a referral to Dr. Matecki. It was a decision that was to really change my life, although Dr. Tracy didn't know it at the time. Anyway, in the addition of alternative integrative therapies to my chemotherapy, surgery, radiation regimen, and a little test called skin carotenoid score, changed everything for me. It told my body what it needed and what it was missing, and what we needed for nutritional supplements. Well, at the time, oncologists, this is 2010, oncologists were not excited at all about having any additions to their therapy. So Dr. Matecki told me to wait. And I asked her again about additions to nutritional therapy, and she's laughing because then I asked her again, and then I asked her again, and finally she relented. So we added nutritional and herbal therapies to my acupuncture treatment. Anyway, the acupuncture reduced the more severe side effects that I was getting from chemotherapy, and the addition of the supplemental nutrients in the herbal therapy surprised everyone because when I went through radiation, I got absolutely no radiation burns, not even pink. Dr. Matecki was so excited that she took pictures of my boobs at the time. She's laughing about that too. She said, I have to have a picture of this. I have to have a picture of this. But the quality that's difficult to measure, but with the highest impact on me, was how I felt. I felt better and better, and by feeling better, it allowed me to become active in other areas important to cancer survival, like eating hearty meals, exercise, walking, hiking, for me, line dancing, and participating in groups. And Dr. Abrams said everything in his lecture. It gave me hope, and hope is very important. And for the next 6 years, following my completion of my chemotherapy, I maintained the herbal and nutritional supplements, chiropractic therapy, acupuncture, nutrition classes, physical activities, massage therapy, yoga, and of course line dancing. And I learned to live each day with things that bring me joy, which is another thing Dr. Abrams mentioned. In fact, I love music, so I learned how to play the ukulele, joined 2 ukulele groups, and learned how to sing along with it, which was really, it still brings me joy, and I still do. Then in 2017, 6 years after the initial cancer, I developed a stage 4 metastatic cancer. Darn. Believing my time was now limited, I began Ibrance therapy and Faslodex and set about getting things in order. I continued with all of my support therapies, and surprise, surprise, here I am. I'm going to be 81 years old next month. Whoa! And I'm starting my 8th year of Ibrance. Integrative medicine therapies have supported my body and allowed it to tolerate 91 courses of Ibrance, 182 5cc injections of Faslodex, and I'm still surprised to suddenly experience the thought, hey, I feel great. I'm a member of a cancer group that hikes Yosemite. Again, Dr. Abrams, get outside. Hikes Yosemite every year. And it's significant that the members of the group doing the best during their extended cancer journeys are those that added alternative integrative medicine early in their treatments and have made them a part of their lifestyle. I believe Eastern medicine seems to recognize the wonderful and powerful ability of the body to try and care for itself, and it promotes the functions of all systems of the body by opening channels of energy flow through acupuncture and movement, while herbs and nutritional supplements provide the body with what it requires to function. My regret is that much of integrative medicine is not currently covered by insurance or Medicare. However, there are doctors and many members of this group, like Amy Matecki and others that I heard today, that are carrying the banner so that in the future integrative medicine can be the standard of care.
Thank you.
That's it.
As I might have predicted, one of the most powerful speakers of the day. Thank you, Bonnie. Okay, come on. We would like to recognize Dr. Yin Peng Chen, and I'll let Amy introduce her. She's the current president of the California Acupuncture Board, and she brought like an army of people to the conference. Thank you.
From Los Angeles. So, wow. Good evening, ladies and gentlemen. I'm very impressed about ICIM's today's meeting and the dinner party. So I heard Dr. Amy Mataki said she felt urgency, burning urgency, and I feel the warmth, the heat in this room. And I also, like Dr. Smalls saying, integrative medicine is people's medicine. And I heard echo from several other people. So whatever we do, the best benefit patients, that's the best medicine. Thank you, everybody.
Thank you, and thank you for all of your support. Dr. Feng, would you come up and help me recognize the faculty, please? We would like to recognize the faculty, beginning with one who was with us from the very beginning.
Dr. Angela Tu.
Yeah, just go down and read it.
Dr. Zhu Xiaoqing. Dr. Rona Ma.
And Gabrielle Lecomte. This group that we're recognizing right now have been with the program since 2009, and they worked for years, voluntary, no compensation, in order to get the program at Highland started. Dr. Wayne Matecki. Chris Randall. Jamie Cedapan. Right here. And I also want to recognize from that group Dr. Tina Chin Kaplan, who had a family emergency and couldn't be with us tonight. And also in the original group, Dr. Alex Fang. And Tin Rin Chu. And someone who joined us just this last year who's been very instrumental in the current program at Alta Bates, Dr. Kara Ramanka. And is Dr. Hong Zhang in here? I would like you to come up, please. She's been part of our faculty this year. She is, I think I'm from the field of workers' comp, so I think of her as a occupational health doctor, so I hope that's right. But it's been delightful having her with us to lecture and support the program. And Dr. Lori Shore-Mortoff. There she is. Thank you, Lori. Dr. Moratoff and Dr. Bateki are in practice together at Cornerstone, and Dr. Moratoff has also been supporting by teaching in our residency program. Okay, we'd like to recognize the California Acupuncture Board, if you would just stand. Ben Bodea, the Executive Officer. Jay Hurt. Jay's back there. And you met their president, and I think there are some board members from the California Acupuncture Board. Dr. Lee, Dr. Kim. Hopefully I didn't forget anybody, but thank you. Thank you for helping give us CEUs. That's very important for our practitioners. Okay, Amy, would you like to come up and introduce the people from SCAPE? Oh, is she not in the room? Oh, there she is. Dr. Gong Li. And this is why you need their help. My Mandarin's not very good. Chen?
Dr. Chen. Dr. Xiang Chen, yeah. So I just want to special thank SCAPE, is a Society of a Chinese American Physician Entrepreneur Group, which founded in 2014. It's over 800 lifetime member. It's a national organization, has been done wonderful work throughout U.S. and China, especially during the COVID time. And also this organization have over 30 specialties. And the physicians, Dr. Chen and Dr. Gang Li, because of this event, they changed their flight to come back early. They were just attended a big residency, international residency conferences in my hometown. which I could not go, but I especially want to thank Dr. Chen from Stanford and many of the titles he has. To me, is most important, he's the director for the International Center at Stanford, especially help and also pave the way for me to become the adjunct faculty. So I'm volunteer there to help, working with the physician resident and the fellows. And Dr. Gang Li is our affairs leader. Both of them, over 10 years ago, co-founded this program and has been support generations here in this country, especially all of us, the special is we both practice in China and also practice here. So I have a residency program. Many of the faculty teach our Chinese medicine students currently is from the SCAPE member. So I just want a special thanks. Thank you, Dr. Chen, Dr. Li, and their wives here. And they drive from Palo Alto further down, right? Los Gatos. So they really want to be here. I want to especially thank you.
Okay, we'd also like to recognize Shizumi and Tyron Creamy, who have been special friends and support to the Matekis as well as us, and who brought us these beautiful peace flowers. Tyron and Shizumi, they don't want to stand. Thank you. They come from the martial arts world with us, but they've been very instrumental in helping to move forth a holistic type of health. Who? Oh, yeah, that's right. Dr. Lynn Berry. Somewhere there's a plaque with your name on it, Lynn, but you know, if something had to get lost, why would it be yours? I don't get it, but Lynn was one of our champions at Highland. She was there from the beginning, from 2009, and helped make it a realization. Thank you.
Thank you very much. This is shocking. The work that Amy came to our residency many, many years ago, when I was actually the program director, and that's where our bond started. And the work that she's done since that time is just far beyond what I could imagine. And we're very proud of her, and her achievements have really helped a lot of people. Thank you.
Thank you. Thank you very much. Yes. I just want to say, without Dr. Lynn Berry, I won't have this Western medicine training starting in this country. So she is my mentor, and also she put up with my broken English in the beginning. Somehow she saw in me, and I didn't see myself, and she's been really like a mother to me through this residency program. I want to especially thank you, Dr. Lynn Berry. And actually, her daughter is here too, Rachel, right? She is our newer generation.
And finally, and I know we might have forgotten someone, but we'll grab you next year. It's always hard to sort out all the many people that have been of such support and help. And Dr. Mateki, of course, said to me, but Charlene, everyone in the room is special. I said, I agree, but it might be hard to do 180 people. So I'd now like just our residents, our current and our former residents from the TCM residency program to stand. So that's our future. Oh, Jeffrey Wong. There he is. Please let everyone know, well, you're the Vice Mayor of Union City, and we appreciate your being here to support us. Thank you. Thank you. Okay. We're almost around the bend.
And I also want a special thanks Dr. Sam Huang and Chulong Xue, Dr. Xue from ACCMA as one of the Chinese medicine organization has been solid support for our program and also for me the process when many of the actions was taken with the board. Actually they are the one help to work with the board. Especially want to thank to EO Ben Boudier also. Thank you.
Okay, if Gregory LeBlanc would come forward, then we're going to have a few words about business, which I think one of the things we've been talking about is money and sustainable futures and how that underpins much of our healthcare system. Gregory LeBlanc is a distinguished teaching fellow at the Berkeley Haas School of Business right up the street, an academic fellow with the Satarja Center for Entrepreneurship and Technology, and you'll see the rest of his bona fides there. We're very happy to have him here to talk to us about the business of healthcare and integrated medicine.
Thank you. So when I was asked to speak about integrative medicine, I was wondering, what the heck can I say about integrative medicine? Why would I be chosen to speak on this topic? Because defined narrowly, I think when we think about integrative medicine, it's about combining different theories and different approaches into a single unified approach to a discipline like medicine. But this term integration has much broader meaning, and I think everyone in this room is thinking about integration all the time. And then I realized that I might actually be someone who could speak to integration because I teach not only business, but also law and engineering and medicine. And I also have a podcast which is called Unsiloed, which is all about overcoming the interdisciplinary obstacles to interdisciplinary research and interdisciplinary thinking. And so what do those four different occupations have in common? That of the engineer, the lawyer, the business person, and the doctor. Well, these are all professions which combine both science and practice. They all combine, in other words, they integrate, both an attempt to understand the world and an effort to change the world. And not only do they combine those two things, but they also are sometimes described as professions. Now, obviously, engineering and business aren't formally organized as professions in the way that lawyers and doctors are, but they both borrow from this notion that as a professional, someone in a profession, this means that you have to combine different duties. You have duties not only to your patients, but you also have duties to the broader society. So as a profession, you're not simply like a scientist trying to make sense of the world, to develop hypotheses and confirm those hypotheses. And unlike someone who goes to trade school, who's just interested in learning how to do something and to accomplish goals and maybe make some money along the way, your job is to combine or to integrate those different things. In fact, it used to be the case that medicine was referred to as a practical art. Until fairly recently, we defined medicine as a practical art, which seems to some degree to be an oxymoron, right? Because in the current environment of higher education, we tend to split off the sciences from the arts, the physical aspects of the world and the spiritual and mental aspects of the world. And I think as integrative medicine practitioners, you are fighting that attempt to split those things apart. In fact, there's a word that the Greeks used, which was phronesis. And phronesis is the art of practical wisdom. And I think people in those professions, and particularly people in the profession of medicine, this is your secret skill. This is the thing that you've been cultivating your entire life, which is the ability to integrate the other virtues into a single virtue. So I want to assess where medicine is today. Medicine makes up nearly 20% of our GDP, and that's just the official medicine, the medicine that is defined as medicine, right, in the GDP statistics. 20% of our GDP, that means 1 out of every $5 of value that is created goes into our medical system. So what are we getting for that, right? Can we do an assessment of that? Are we getting our money's worth? Now look, there's been an amazing amount of progress over the last couple centuries. America, in many ways, is probably the place with the best medicine on the planet for certain ailments and diseases. But we can also see there's been some retrogression and failure to make progress. In many ways, we're sicker than we were in the past, if you evaluate the entire human being. There are epidemics of loneliness, right? There's epidemics of depression. There's epidemics of all sorts of other psychological disorders, right? I don't think anyone would characterize 2024 America as the happiest of possible lands. And so there seems to be something that is wrong with this investment. And so I just want to evaluate how medicine works both on the knowledge side and the practice side. And I think that there's room for improvement in both domains. So just starting with the knowledge side, right? How does knowledge advance? And this is something that I've spent a lot of my career thinking about. Well, the way knowledge advances is through the adoption of good ideas and the rejection of bad ideas, right? I mean, it's that simple, right? You see something works and you diffuse it. You see something doesn't work and you eliminate it. So I was trained as an historian, and it's really easy to go and judge the past. We can look at the medicine of the past and see all sorts of failure. We can see the failure to adopt good ideas. There were some people who realized that citrus fruits could prevent scurvy, and it took hundreds of years for this idea to disseminate throughout the entire world. And if you read the history of this, it's phenomenal, because people would see that it worked, and for some reason they would refuse to believe it and refuse to adopt these practices, even at the expense of their own lives. Okay? Vaccination and variolation. I mean, it took hundreds of years after the initial discovery of something like variolation for it to be diffused throughout the entire world. So we know historically that it took a really long time for good ideas to get adopted. And we also know historically that bad ideas would persist forever. I mean, George Washington was bled to death by his doctor. I mean, terrible idea. Why did this idea stick around for hundreds of years? And so we look at the past and we think, those people, they didn't get it. You know, they really weren't good scientists. But we look around and we see all sorts of examples of bad ideas that persist and good ideas that struggle to make it into the mainstream. I've done numerous podcasts on all of these. I mean, we can look at something like obstetrics, where the collective historical wisdom of midwives and doulas were just completely extinguished by the obstetrics profession, right? We can look at traditional dietary advice around diabetes, which was to avoid carbohydrates. And then for the last 50 years or so, we've had the medical profession telling diabetics to eat carbohydrates, right? With absolutely no scientific evidence to suggest that this was a good idea, right? I did a podcast on that. Our understanding of allergies is bizarre and confusing. I mean, I know that it was fairly common knowledge among a certain group of immunologists that you definitely want to expose your children to certain proteins to minimize the likelihood of an allergic reaction, and yet doctors would continue to recommend that their patients avoid these things. Not because of any scientific evidence, but because this just happened to be the advice that they got through osmosis from other doctors. And of course, pain management. I mean, pain management is the classic case of bad science. I remember going to the National Institute of Health back in 2000, where they were talking about this new idea that opiates weren't addictive, right? And everyone's like, oh yeah, you know, opiates are great. And when you look at the scientific evidence for this entire movement, where most pain doctors adopted an aggressive use of opiates, this was based on a note a note, right, in the New England Journal of Medicine. Not a study, not a controlled, not a RCT, nothing. It was just a speculation by some doctor, and then all of a sudden it became the conventional wisdom. How does that happen in the 21st century? It's kind of mind-boggling, right? And so in order to understand this, one way is to kind of take a look at the mental models that people use in the profession. As someone who has struggled his whole life to try to overcome the tendency towards specialization, I think one of the problems is that in many professions, economically, it makes sense to specialize. And so we've sort of over-indexed on the number of specialists, and we really fail to reward the generalists adequately. In fact, a lot of medical practitioners are discouraged from becoming general practitioners, and as a result, they lose an understanding of the entire patient and how the different parts of the body fit together, much less the way the body and the mind and the spirit fit together. So that's a mental model. They stick to mental models that make sense to them, that anybody who's been exposed to logic or inference or statistics would find wanting, such as if something doesn't work in a small dose, well, then you must increase the dose. And if it doesn't work at that dose, then you increase it further because you have a prior that it somehow is going to work. Or if something is bad for you in large doses, it must be large for you in small doses, which doesn't follow at all from the rules of logic. So a lot of it has to do with mental models. I've done a lot of research on the biases and heuristics that professionals suffer from, and they're no better than the rest of us, perhaps even worse. Overconfidence. The most overconfident people on the planet are doctors. I used to think it was MBAs, but it's actually doctors. Doctors are extremely overconfident, which means that their bad notions and bad ideas become sticky. Most doctors have a very poor understanding of statistics. They don't know what confidence intervals are, and they don't really understand conditional probabilities. But I think the bigger problem is economic, and I think you need to look at the political economy of how medicine is practiced in the United States. Because, look, as someone who teaches economics and business, we all know that people do what they're rewarded for, and they don't do what they're not rewarded for. Okay? In general, obviously there are people that resist this, but when the marketplace tells you that, you should do it, then who are you to say, well, I know different, right? And so what does the political economy of medicine reward? Well, for one thing, it doesn't reward prevention, right? It rewards cure or treatment. And so the fee-for-service model is one that if your patient is sick, you get rewarded, and if they get even sicker, you get rewarded more still. Okay? And everyone in the medical profession understands this. Everyone knows this. Everyone knows it's a problem, but we haven't done a very good job of figuring out how to reverse those incentives where people are rewarded for keeping their patient healthy and penalized when their patients become sick. Okay, there's been enormous research on this. Definitely Medicare has been trying to do some things in this area, but it's a very difficult thing given the way our political economy is set up. The other thing is the short-term versus long-term. We reward immediate fixes, and we don't worry too much about what happens down the road. So one of the people that I interviewed for my podcast was in a terrible accident, was prescribed opiates, and then had a very difficult time getting off the opiates. And that was, of course, understandable, but what was not understandable was that his doctors, his pain doctor, had no clue, had no idea how to get off these drugs, and actually gave them the advice and said, well, if you're having trouble getting off them, why don't you just stay on them, right? Like I just need to kick the can down the road, solve the problem, make sure that you make it through till tomorrow without thinking about the spillovers. So part of your job is to think about spillovers, again, to integrate the present with the future, integrate the impact on the patient's body with their mind, and integrate the impact on the patient with the community around them, right? So we all know about antibiotic resistance. This is a failure to think about spillovers across patients, right, and the impact on society. Okay, so and then of course the KPIs that we're typically thinking about. If you're a specialist, again, you're interested in reducing the harm within your area of expertise. So if you are visiting a dermatologist, they're primarily concerned with minimizing your risk of skin cancer, and they do a fantastic job of this. One of their recommendations is to avoid sunlight at all cost. Now, of course, you know, if you know anything about medicine outside of dermatology, you might realize that this is going to have harmful effects. But again, it's not the dermatologist's problem, because the dermatologist has done their job, right? And they did a great job of it. But that doesn't mean that the patient's lifespan or health span has improved as a result of this intervention. So again, the problem in that case is integration. Now, if we think more broadly about the systemic problem, which one is one that I think you are all facing, and that is that intellectual property is where everything's at. Every single one of my students who is interested in doing a healthcare startup, investing in some new innovation, some new therapy, or some new medical device, the only reason why they're doing it is because they have intellectual property, right? And anything that doesn't have intellectual property is just simply not interesting, right? And so there are therapies as simple as aspirin, which have no intellectual property around them. And so as a result, there's no real incentive for anyone to do clinical trials on it, nor is there any interest in prescribing it. There's no one that is going to give you, pens and paper, much less a free wing on your house for prescribing aspirin. Okay, whereas you will get all sorts of goodies if you prescribe medicine that has intellectual property around it. So the intellectual property system is what has made for enormous progress in so many domains, but it distorts the way investment is being made. And so there's a massive deficiency in research on things and therapies that don't have intellectual property around them. I don't know if you can't really patent acupuncture. There's no copyright around it. There might be some trademark. If you guys want to set up some clinics with some snazzy brand name, then that's fantastic. But in terms of patents and intellectual property, it's going to be very, very, very difficult. And so we need research, and we need research that will investigate the impact of different types of interventions that aren't funded by for-profit pharmaceutical companies or medical device companies. So look, I could go on and on and on. I've done plenty of podcasts on, if I could talk about the nutrition. Nutrition is an area that's particular interest to me. Dietetics is fascinating. I remember when I was a kid, I started cooking, and I started using some of my mom's cookbooks and recipes. And as I was doing all these recipes and making all these meals, and I was like, this is really strange. Every single recipe in this book has a can of Campbell's soup in it. Like, this is so weird, right? And then I started reading all the, magazines, Red Book and Women's Day and all the magazines she got, and every single recipe had some kind of branded product in it, like Durkee's fried onions or something. I was like, this is really, really strange. And then I wondered, why does my mom make tuna helper and everything else? Well, this is what she's bombarded every day with ads telling her that this is what the modern woman does. I was raised on formula. Why? Because that's what the modern woman did in the 1960s, right? So, these are not decisions that are being made on the basis of science. These are decisions that are made on the basis of advertising, economics, and all the stuff that I teach my MBA students, which is go out and make some money through marketing. And of course, we live in a capitalist society, and so that's what people are going to do. So how do you immunize yourself against that if you're an ordinary person? And it really goes back to just using common sense and thinking for yourself. I tell my MBA students that if you're an MBA student, you don't actually have any kind of expertise at all, right? If anybody here an MBA? Okay, you know this, right? If you're an MBA and you have a difficult statistical problem, you hire a statistician, right? If you have a difficult financial problem, you hire a finance person. What you do when you go to get a business degree is you learn to get a PhD in common sense. And if you really, really take it seriously and you go to a good school, That's what you learn. You learn to think for yourself. You learn to question everything. You learn to scrutinize the evidence. You learn to look for good research. You learn to be skeptical of things that you're told by people who have a financial interest in what they're saying. And so my plea to you is to continue the good work, to continue to be an integrator, right? Continue to be the kind of person that steps back and thinks about how you can combine things, combine mind, body, and spirit, combine East and West, combine specialized with general, combine the things that happen on one part of your body with the things that happen on the other part of your body, and certainly think about the things that go beyond the traditional scope of medicine, because they're the ones that have the biggest impact on your lifespan and health span. We have just gone through a pandemic which, revealed a lot of things about America. Of course, we all know that the rapid development of the vaccines, I mean, it's an amazing scientific accomplishment, what happened there. But what I think it really revealed is that we're a very sick nation, right? We are a really unhealthy country. Our mortality rate for COVID was among the highest in the world. And it's puzzling, right? And why is that? And a lot of it has to do with underlying, metabolic illness, high degrees of toxic stress, all sorts of things. And the diagnosis is there, and the cures are there. The remedies are available. It's not a lack of scientific knowledge. It's a lack of the proper mental frameworks and mental models among medical practitioners, and it's a flaw in the political economy. And so I think that all of us should be joining together to think seriously about how we can not only reinvent the way medical practitioners both pursue knowledge but also engage in practice, because that's your job, to integrate knowledge and practice and do it in a responsible way, because you're not only scientists and practitioners, you're also humanists. Right? You are humanists. You are fundamentally sitting at the center of what it means to be a human being. And so I'm glad I was able to come here and learn a little more about what you guys are doing. And so just keep up the good work, and thanks for letting me speak to you. Appreciate it.
You were spot on.
Oh, thanks.
And I didn't have to bribe him or anything. That was just right on target, I think. And I think now Greg's a formal member of the ICIM family. We'll be calling on you again. Thank you. That was excellent. We were entertaining open mic, but before I do that, I forgot two important tie-ties. The wife of Dr. Feeney, Lita Duran, and the wife of Craig Brandt, Ann Wrench. If you'd stand, please. They've both been very instrumental in keeping the board going, not complaining about the hours or the stresses. And Lita have had us in her home before the pandemic every month. And Anne supported the board not only by supporting Craig, but also helping with bookkeeping and some administrative duties. Thank you. And before I turn over the mic, I would like all the patients to stand up. Dr. Matecki is so grateful to all of you for your support. Thank you. These are the people that are sort of the proof of our pudding. So they're very important to us. And the fact that they come out and sit with us and engage is great nourishment for us, but also a testimony to the rest of the world about the power of integrative medicine. Dr. Matecki, is there anything else you want to say?
I just want to thank everyone to be here tonight and the whole day. It means so much for me. As a matter of fact, I think when I started opening, I had a burning desire. Now I find that there is a business, a JD, can help ICIM some money, and also, and also most important, I like to change the healthcare system. For 20 years, when I opened, I said my Medicare patients get a cut, a physician not get reimbursed. My partner's here, and she can help me. She's the one actually keep the bookkeep for my practice because I was busy doing all this other work. But I really feel the pain for a physician, insurance company not listen to us. And here, one side, we suffer economically, but it's really how can I help to change for physician to provide the meaningful practice and also for the patients to get the best care. So finally I said, talk to Dr. Osler, Dr. Fan. I said, let's just do this conference, even in a short 4 months. And then we say, where do we start? Berkeley. My practice is starting in Alta Bates, Herrick campus, Berkeley here, because I believe Berkeley is the mover, shaker, is the alternative of the heaven. So I thought, I need a Berkeley patients. And now with a healthcare provider, and my patients always get me in trouble, right? So let's just see how we can contribute as a healthcare provider. I have so many of you here are mentor for me, and for the past 24 years in the U.S. And also, I just want to especially thank each one of you has been so supportive for me day and night, and especially thanks to Dr. Osler. For the last 4 months, even last night, she worked till 2 o'clock in the morning. And without her, and the team with the tech, everybody here to support for the registration, and a special our resident, TCM resident, and thank you is out of my expectation for what you guys have done today. I can thank each of you in the room, but mostly important, let's Berkeley be the place to change this sick care model. Thank you.
Thank you. Is there anybody else that wants to come up and say anything? Yes?
Okay, so I have 2 options for you. One is take a picture of me right now, and the second option is on your table. There's one of these. And I want you to find that one person at the table and make them do a selfie with them. All right? Me or someone at the table. So I'll be here for a minute. I won't say anything. Get your phone out. Come on, come on. Either you're going to take one now, or you're going to take one in a minute with someone at your table. Now, I know that there's at least one person at each table that's been given a secret message from me to ask you to take a picture. So find that person at your table, and if there isn't one, volunteer to do it for me, and I will thank you greatly. Now, did everyone get my picture? Okay? All right, thank you again, everyone, and see you soon.
So mark the date for next year. We really appreciate all of you. Thank you for being with us. We have a few minutes before we need to close at 8:30 for people to do some networking and exchange business cards and write that date in your calendar. Thank you all. Thank you for being with us.
you.